Good morning, everybody. I am so honored to be here in this panel and so early in the morning. So I'm happy that everybody, that was interested is here. And I am going to introduce my speakers, but before then, I just wanted to see, with this conversation on maternal health, on the Millennium Development Goal 5, I would like to just set the scene about, what, we expect from this conversation. And I just wanted to say that the previous speakers from the UN, they are talking about the 1,000 days that are left for achieving the Millennium Development Goals. So we are here in a countdown mood. And so we are here, thinking about the urgency to really achieve those goals. It is about women. It is about women giving birth. And it is about women not just giving birth, but not wanting to give birth as well. And it is about adolescents that are married when they don't want to be married. And it is about all these young people who exercise the right to, enjoy sex, etc., but they don't want to become pregnant. But I just wanted to tell you that two things that we want to see. First is what media can do to push for during those 1,000 days that are left, and the other one has to do with, what is needed exactly, what is needed to really achieve that women do not die in childbirth and do not die because of pregnancy. We are all touched by these stories. I wanted to read one passage that is about a human story. It happened in India. It's a very, the media, have the capacity to show in 2 words what is for a woman to suffer through when they go to childbirth. And this is the story of Saraj, who told the story of her daughter, Kavita, in Uttar Pradesh in India. We took her to the community health center and they said, we cannot look at this here. So we took her to the hospital in Hyderabad, from Hyderabad to Balrapur, and from there to Lucknow, all government hospital, from Wednesday to Sunday. So you can imagine, from Wednesday to Sunday. For 5 days, we took her from one hospital to another. No one wanted to admit her. In Lucknow, they admit her and started treatment. They treat her for about 1 hour and then she died. So this is the story of many women who die in these conditions. They are not accepted by the hospitals because they don't have the capacity to treat them. So having said that, I would like to introduce my speakers. And I'm glad that we have Lisa Russell here, who is an Emmy Award-winning documentary filmmaker and new media specialist, whose background in humanitarian and international development work has inspired her to produce films about the health and well-being of our global society. So Lisa's work has been broadcast on public television, including PBS and Channel 4 in London. Other work is tied into advocacy, fundraising, or legislative efforts with the UN and international agencies. In 2009, Lisa collaborated with ZAP Marna to create the Woman Tour, a nationwide initiative of film screening and musical performance to increase awareness of global women's health. And this is amazing that in 2010, at the MDG Summit, Lisa debuted MDG5.com. She created a website to promote and to unite artists and activists around maternal health. So I just wanted to also introduce Jill Sheffield. Is a global educator and advocate, who has worked to promote women's health and rights around the world for more than 3 decades. Jill is very well known as an advocate. She has created the Women's Deliver conferences, the one that was done in 2007, but also she was the founder of the Family Care International, an NGO that has advocated for reproductive health and rights for more than 3 decades as well. And then Robin Smalley, who enjoyed an award-winning career as a television producer, director, writer, before realizing that the legacy she wanted to leave had nothing to do with entertainment. So, so you will learn from her. And turning her attention to the nonprofit world, she became the executive director of the Media Project, working to incorporate healthy messages around sexuality, reproductive health into television. From there, she uprooted her family to South Africa. That's amazing that she was able to do that. When she co-founded Mother to Mothers, it's a very well-known NGO operating in 7 sub-Saharan countries to provide education, employment, and empowerment to HIV-positive mothers, pregnant women, and new mothers, and is part of the UN Global Plan to eliminate pediatric AIDS by the year 2015 and keep mothers alive. So, Robin, Jill, and Lisa. So I would like to start with Lisa and wanted to ask you, your career is impressive. You have been all over the world filming on issues of women's health and maternal health in particular. What brought you there, and where are you going now?
Okay, thank you. So, can you hear me okay? Yep, I think can I move this real quick? Okay, so I am a filmmaker, but I didn't go to film school. I started off my career working in the development world as a humanitarian aid worker. And when I was working in Kosovo in the 90s, 1999, I was observing how the media was portraying the people and the war that I was involved in. And I just became very critical about what I was seeing and just conversations that I had about how journalists were dealing with very sensitive topics like rape and sexual violence. And so I through some experiences, just to make a long story short, found my way into filmmaking and learned the craft. I'm a self-taught one-person filmmaker that wanted to utilize my contacts in the UN NGO world to make films. And I never embarked on a path to focus only on maternal health, but in 2003 and 2004 I wanted to do a film about women because there were these 10-year anniversaries of these big international conferences, if you've heard of them, the Cairo conference, the Beijing conference, and they talked a lot about the role of women in development. And when I did a film on this horrific childbearing injury that not too many people had heard about called obstetric fistula, and it was like the first day that I was filming, that I went to Niger to make this film, and I was exposed to really how critical this issue is. One of the things that, I don't know if it's going to come out in these conversations, is that when you talk about the MDGs, MDG 5, which is focused on improving maternal health, is the one that people say is the most lacking in progress. So when you're talking about health and livelihood of mothers, and you're saying that we're not making any progress or we're lagging in progress, it's critical. But anyway, I went to this maternity hospital to film what I thought was going to be a fantastic, look at how C-sections are done and, experienced personnel or whatnot. And I was, the first day, arrived and a woman had been waiting in labor. She had spent 5 days getting to the hospital. When she got to the hospital, she arrived at 6 a.m., we arrived at noon. It was sort of like, why hasn't she gotten her surgery? And they're like, well, the family doesn't have the money for the needles or the syringes, which is what is required in Niger, is that if you come to the hospital, you need to bring all the materials with you, and her family was too poor to afford it. So when we finally, we're not supposed to do this, but we donated money to get her the utensils and the supplies, and when she finally got the surgery, they rushed the baby into the ICU unit, and they spent like 15 minutes trying to revive this baby. And I was like, wow, I'm really going to film a baby dying on camera. Like, it was sort of a big shock for me. And it was, I think, at that point that I said, okay, this is critical. When you think about the lives of mothers and you think what it does for society as a whole. I think maternal health is sort of the entryway into everything else that goes on. If a girl doesn't have education, you're going to have maternal health problems. If girls don't have rights, you're going to have maternal health problems. If there's no transportation, you're going to have maternal health problems. So it's a look for me into sort of larger development issues. So I think I know we don't have a lot of time, so I'll just stop there.
Thank you, Lisa.
Yes,
this
thank
is
you.
very powerful. Nigeria is a country that in which more than half of the girls married by the age of 15. So turning to Jill, I just wanted to, you have a long career in advocacy, and we really admire you for what you have done in terms of bringing the issue of maternal health to the public. What has brought you here, and what do you think, from the days of your early involvement on this, and where do you think, we have arrived, and what is the next push that we need in terms of achieving this important goal of making sure that women don't die in childbirth and in pregnancy?
Great questions, really super. I don't know how many of you agree that your career path is often a surprise. Clearly it was to Lisa. It certainly was to me, because I was teaching at a university in Nairobi, and it was mostly closed because the students were on strike. So I went to work for the first family planning clinic. I thought that giving women those choices was a really important way to spend my time until everybody got back to school, which never happened for me. I didn't go back. But the real moment for me, it was so wonderful, because there was such hope, such enthusiasm, such need for this clinic. It was adjacent to a maternity hospital, a very large maternity hospital, the Pumwani Hospital, that did 100 deliveries a day. And until this clinic turned up, there were no family planning services any place in Kenya. It was one of the first in Africa. So on my 27th birthday, which is just a little while ago, I was interviewing patients coming in, the women who were coming. And a young mother came to me, clearly identifiable as a young mother, because she had a new baby on her front and her oldest new baby on her back. Turned out she'd been on a bus since 4 a.m., and this clinic didn't open until 2, and that hot equator sun was hot. She came to me, and it turned out on my 27th birthday that she was also 27. But there, the comparisons absolutely stopped, because she had had 11 pregnancies, and she only had 6 living children. And it was that moment, like Lisa had, and I thought, holy smokes, this is not good, because women in most agricultural economies are the backbone of the family economy. And imagine having 11 pregnancies and the sadness of only having 6 of those pregnancies grow to small children and then big children. So on that day, I decided that my job was going to be to make sure women had those choices. So a lot of things happened in the interim, and when you look back, it always looks like a straight line, but trust me, it's really not. It's full of zigs and zags and misbegotten decisions and all of that. So it brought me to the moment when the world heard for the first time in 1985 that one woman was dying every single minute someplace in the world, simply related to pregnancy and childbirth. And it was a question from the World Health Organization, is this true or not? Well, we set about, I started an organization called Family Care International, and we set about working with partners, powerful partners and really effective small-scale partners as well, to find out if this was true, and we found out it is true. And it's not right, because we know how to fix this development problem, and it's not so expensive to fix it. What it requires is expensive, and that's political will. Fast forward, how many years is that, from 1985 to today? What we're still missing in most of the world is political will. We've chronicled the solutions. We know what works. Some of them are facility-based, hospital-based. Some of them are simply community-based, easy things that are inexpensive. But on the large scale, there has to be political will to see these things happen. We're coming to the end of the Millennium Development Goals. 2015 is when we're supposed to have met these wonderful objectives. Well, the one that's absolutely smack dab in the middle, MDG 5, is all about reducing maternal mortality and making sure there's access to everybody for sexual and reproductive health services, including family planning. It has been the least invested of all the MDGs and the least progress against our numerical goals. It's really wrong. So we're still trying to work on that and fix it, and we're having great success, because the really good news today is that maternal mortality has really declined by almost 50%. Some of that, I think, is that we're counting better, but some of it is that some governments, a lot of governments, have taken this seriously and really understand the value of girls and women. So as our conversation continues, that is my direction for where we are and where we have to go. It's really looking at the equality issues related to girls and women, because they are our partners in development.
Okay, great, Jill. Thank you so much. And basically setting the scene in terms of where we have to go. It's true that we have to, the numbers of maternal death have started to decline, and this is fantastic news, because for many, many years it did not move. And so there is a movement going, and we need to push it a little bit hard in the last years. So I will turn now to Robin, because Robin represents somebody who has worked on another area that is so key for maternal health, which is HIV. How do you make women who are HIV positive to make sure that we eliminate the transmission from mother to children but keep the mothers alive? And this is so important, because one of the reasons in some high burden countries of HIV, of which women die in childbirth, has to do with HIV. So I wanted to look at, to hear about your story. It's great that you were in entertainment. From there, you decided that much more needed to be done on the ground, on, helping mothers directly. So tell us your story.
Well, can you hear me? Yes. I'm so happy to be here because I'm really passionate about this issue. I decided to go into television when I was young because I really believed, and still do really believe, that media has the greatest power to affect change that there is, the greatest power to adjust social norms, to educate, to empower, to engage people's heart to do the right thing. And so that was always my intention. And when I graduated college and Barbara Walters didn't call me and offer me her job, which was a huge disappointment to me, actually. I thought, well, what can I do? And so I started working in those days on what was called reality television, way before we had the Housewives of anybody. And during those years of directing and producing reality shows, I was able to do a lot of programming that I thought was great, segments that I thought helped people and educated people. But those got fewer and fewer, and I found myself doing more and more cooking demos and makeovers, and was getting unhappy about it because I felt like this tremendous potential power was really being wasted. And I had 2 children of my own, and I didn't want, as you said, I didn't want that to be my legacy to the world, was, one more, makeover. And so I ended up going to work at an organization called the Media Project, because that really epitomized what I thought I could put my talents and experience to. At the Media Project, we worked with TV producers and writers and film in the area of adolescent sexuality and reproductive health, working with them to incorporate storylines that not only were entertaining, but also normalized healthy behaviors, condom use, reproductive health, family planning, parent-child communication about sex, teen pregnancy, all of those issues. And again, it was really wonderful to be able to straddle both those worlds and work with creative people who really did want to do good, although their first priority was entertaining, as it should be. So I did that for a number of years, and it was really satisfying. And then I took a trip to South Africa to visit a dear friend who was living there, who was an obstetrician, who ended up becoming my partner in Mothers to Mothers, and went with him on rounds. And his specialization was HIV-positive pregnant women. And I'll set a scene for you, because you're all interested in storytelling, and this is the story that made me change my life and the lives of my family. What I was seeing on that very first day there were young women coming in for their first prenatal visit. Usually they'd be around 4 or 5 months pregnant, and they'd be just like I was when I was pregnant, and so full of joy and hope and excitement about this new life that they had inside them. And at that time, they would be offered their first HIV test. And when it would come back positive, because the health system is so overburdened and there really are no doctors and the nurses are overworked and overwhelmed and overstressed, they would get this diagnosis, and there would be nobody there to tell them that medical intervention was available right there in that clinic. So they had no idea. They thought it was a death sentence for themselves and for their child. And because of the terrible stigma in their community, would be afraid to disclose to their partner, to their mother, to their family, to anybody. And they'd leave the clinic and go home to die and never come back and access the treatment that actually was available. And Mitch was seeing this happen over and over again, and I thought, this is unacceptable. I mean, here governments are pouring millions of dollars into medicine, but medicine doesn't equal medical care. And so we decided to take the best resource we have in Africa, which are the mothers themselves, and put them at the center of the solution of ending pediatric AIDS and keeping mothers alive. By taking new mothers who are HIV positive, training them and employing them as mentor mothers, so that when that young woman comes in, immediately there's a mentor mother who can hold her hand and put her arms around her and say, you're not alone. I'm positive too. My baby was born negative. We're going to get through this together. And she becomes surrounded by women like her, and she can get counseled every day. And these women, they're paid, so they're empowered. They become role models in their townships and villages. They become the go-to people. And the power of this model now extends to other things, extends to reproductive health and family planning, extends to all the areas that women need to make healthy choices for themselves and their families. And so we started out in a car in Cape Town with our credit cards and with a lot of debt. And today we operate, by the end of the first 10 years, we were in 9 countries, about 800 sites, and the largest employer of HIV-positive women globally. So it's been an amazing ride, and as Jill says, one that I never in a million years would have anticipated. And so now, these are the stories that we need to get out there. These are where we have to rally everybody around, is saving women's lives. And look, it's about women and children together. Although we focus on ending pediatric AIDS, the fact is, if you took every young person under the age of 15 in California and Oregon and the Washington State and Arizona and New Mexico, and they were suddenly orphaned, that would still be fewer than the number of orphans we have in sub-Saharan Africa. So that's a story that has to be told.
Well, fantastic story. I think it's one lesson I learned from your story is the power of solidarity among women. And I think this is a powerful element for programs, because we are seeing this in programs in which the girls are being married. And if we, create safe spaces for these girls, they flourish in a way that they support each other to really work against child marriage, for example. A great, intervention. I just want to, turn to Lisa. Lisa has, as she has said in Niger, from her experience in Niger, she has, gained a lot of experience in terms of showing and telling the story. What will be for you, one, story that you will tell to politicians, as Jill has said, how important it is and the difficulty in getting the commitment of that high level, that you will depict in a documentary to show, that we need now go and get to the date, the final date of the Millennium Development Goals deadline. What would you do?
Okay, well, that's a heavy, heavy question. But, instead of actually talking about the issue, I'm going to talk about what I think is more important in terms of the process. Because I straddle these two worlds. I work, my background, my training is in international development. I know all the UN lingo. I know people in that world. But when in my social life and in the work that I do overseas, I'm also embedded in the kind of international social issue artist community. And it's really funny to me because I'll give you an example in Tanzania. I'll go and start my first day of shooting and I'll get picked up in the white SUV and I'll get taken to the US Embassy and I'll meet with all the officials and they will tell me all the great stuff that they're doing, programs and whatnot, to save people's lives, and it's really impressive. And then they'll drop me off at the hotel and then my hip hop artist friends or my filmmaker friends will be like, we're gonna come pick you up and we're gonna go to Cocoa Beach and we wanna shoot this video because we wanna do it to help save people's lives. So there's what I feel is a parallel conversation taking place between the development world and the artist world, and they all have similar interest in improving the lives of their communities, but they don't talk very well together. And I'm not exactly sure why. I have my own ideas about it, but I guess this is just to say that there are so many stories that should and could be told, and the UN and the NGO community has the access, the resources, they make policies, it's great. I believe the artists are the ones who make really change at the community level. They're the ones who can reach people, in rural Sierra Leone. There's a woman who should have had the information that she could have had free healthcare, but she's not getting that information. I think the artists who have incredible reach at the community level could share that information, but these worlds aren't talking. So instead of telling you what the one issue is, what I would encourage is that people, whether they're filmmakers, poets, musicians, DJs, whatever, if there is a desire to get into this world, I'm trying to bridge these two worlds because I think that a conversation needs to happen that's not happening, and I think they could both be helping each other. So sorry to
that's
twist the
no, but that was very good. These were very good, and so this bridge between the two worlds, is something that needs to happen. Then this is what it needs to happen. So, Jill, you are about to organize a big conference in Kuala Lumpur in May, at the end of May, and that conference, an advocacy conference, is coming at a critical time, we say, for this push, for this effort that we are all doing to achieve the Millennium Development Goal 5. What are you expecting for the conference? How this work, how this work could help the media world in getting the messages across?
That's a perfect question, and I promise you I didn't put her up to it, but it's time for a commercial, and all of you are invited. Women Deliver is about women delivering babies, sure, because guys can't do that yet. But it's also about the fact that women deliver everything. Supper and laundry and kids' school fees and just all those great things. And it focuses on a huge range of development issues that all converge over the lives of girls and women. Because frankly, if you work on education or human rights or the environment or nutrition, and if she dies, then your investment's gone. And we can't afford that. We just can't afford that. So what's going to happen at Women Deliver is really super. Really, you ought to plan to be there. I know Malaysia's a little far away. If you can't get there in person, the press conferences and the plenary sessions are going to be webcast. But we're starting off with new evidence, with new data that tells us why investing in girls and women is not just the right thing to do, it's really the smart thing to do. But then we reach Lisa's issues, because Lisa's going to be there. And it's because those numbers are pretty dry, and who knows what they really mean anyway. So we have to translate that dry, valuable data, new evidence, into reality for people. So at Women Deliver, we have evidence, which I hope is not going to be quite as dry as I'm suggesting it might be, because we're having a cinema corner, which Lisa is curating. And we have films, short ones, long ones, from every corner of the world that's looking at this set of issues. We are having, this is really fun, Liza Donnelly, who is the curator of cartoons at The New Yorker, really offered to do a cartoon collection that's about girls and women from all over the world. And we're publishing that in a small book. And they are nothing short of delicious. In my next life, that's what I want to be, is a political cartoonist. Because in one frame, you get a story and usually some humor about it. So we're trying to move people from different vantage points so that they understand the problem, but they also understand that there are some solutions to it. And I think that's where we are. We have that data, and it's how we use that to convince people who hold power. And honestly, it's power in the boardrooms, but it's also power in the bedrooms, because oftentimes it's in the home that there's the shortfall. So we're trying it all that. If you come, you'll find 5,000 people from already 147 countries signed up, and they're big deals. They're ministers of finance, ministers of health, few heads of state, and you'll find princesses.
Yeah.
But they're also journalists, a lot of journalists, and you are our hope.
Okay, so great, Jill, and for everybody, you can, link to the Women Deliver conference in Women Deliver. You could find it online. For Robin, and we have, very short time, only 5 minutes, and I want to at least get one question or two from the audience. Robin, quickly, what is next from, the elimination? Now is elimination of mother to child transmission, and keeping the mothers alive. What is next? How, because this, we are, I ask you to tell the story. Where are we going? What is the push that we want to achieve?
Well, as you said, we're in a countdown mode. We have real urgency now. We're looking at 2015. It's not very far away, and we need all the support we can get. We need the whole world to know about it. I mean, we in the public health world know, but the most educated person on the street probably has no idea that we're in this. This battle to end pediatric AIDS, not in 100 years, not in 50 years, not by the next generation, but now, or as we say in South Africa, now. So we need all the support. I mean, numbers are dry, but one number that isn't dry to me is that we have less than one baby a day born here in the U.S. with HIV. We have 900 babies born with HIV every single day in the developing world, most in sub-Saharan Africa, every one of them unnecessarily, every one of them. It is such a tragedy, and what I want to say before we run out of time is, it plays off of what Jill was saying, is that we talk a lot about women and girls, but we got to bring men into this equation, because women can't do it all themselves. And you go to a lot of these, you know, these places, and the dialogues are wonderful, but the men aren't in them. And without the fathers caring about losing mothers and caring about, they do care, that's the wrong way to say it. The fathers do care, but they don't know how to behave in ways that are going to support the family. And that's where media and news and film and art is so important. I mentioned normalizing behaviors. We need to see how that looks, you know, and how that feels and how that sounds, so that men around the world can get on board.
Okay, great message. The message is get men involved, and the campaign is getting mother-to-child transmission to 0. Questions, we would love to open it for questions from the audience. We see a lot of men here, so it will be great if we get questions from them too. Yeah. Yes?
Hi, my name is Michael Skinner. I'm with Pendragon Productions in Washington, D.C. We're hired quite frequently by people to tell stories to try to make a difference. And as a storyteller, we have a lot of control over the story that we tell, but not a lot of control over the way that the story is used. And so I'm curious if you have any examples of an excellent use of storytelling, or the excellent use of a story to make a difference with policymakers or with people who are in a position. Because there is this gap between people who are able to tell stories and people who hold the purse strings to make a difference in their society. So I just love a single example of something that really made a difference.
Okay, great question. I would like to ask Lisa if you could respond to this question.
Okay, well, I've done some Capitol Hill screenings, and that's I mean, there's a standard template that you can use to approach that, get your congressperson on board, get them to advocate for a screening, on Capitol Hill or whatnot. But I'll give you an example of something that I thought was very, very useful for what I've done. And first of all, when I make films, I have a lot of creative control, because sometimes I'll either get hired and I'll be contracted and I'll do the films, and you're right, like, they own the distribution kind of process. But if you have an idea and you can get funding and let it be your creation, when I did my film on fistula back in the day, I was an unknown filmmaker. I wasn't media trained, but I was like, half the battle was making the film. How do I get the film seen? And Zap Mama, who's this fantastic, beautiful female artist from the Congo, who has a huge following internationally, her music, she agreed to give me music in the film. So we got together and we started talking, like, well, how can we use this film to really start a dialogue and raise awareness? So she was already planning her US tour for 3.5 weeks. So I was like, why don't I come with you, and I'll set up screenings in the daytime. And I had never heard of anything like that before. At that time, I was like, I cannot believe that I'm getting on a band bus and traveling across the United States. But what I learned from that experience is that we cross-sectioned our followers. So I would go and set up a screening at UCLA, for example. Her fans, who knew nothing about obstetric, fistula, or maternal health, would come because they wanted an opportunity to see Zap Mama speak. So they would come and they would learn about something that they wouldn't otherwise be, educated about. During her shows, I would set up a table, like a merchandise table. There's her T-shirts, here's her albums, and I would sell copies of my film and distribute information about fistula. And so I would get people who were at her shows just being like, oh, this is cool, what is this up to, or whatever. They take stuff down. And from that point forward, I released that film in 2004. I still screen that film. I still get invited to show that film now, and that's from people who may have been at the concert. I saw you speak at UCLA. My family does DC influential fundraisers. I got asked to screen the film. They raised like $19,000 for UNFPA. So I just say, be creative. Like I always say, making the film is half the battle. Go break the traditional cycle of having a broadcast this or theatrical, whatever. Like, own the film and figure out what you can do to get it seen.
Great example. So anybody else has another question? We'll have time for one more question. A comment? Yes, please go ahead.
Hi, my name is Denise. I am a future public health student. I'll start in the fall. really
Speak up,
interested
please.
in
Yeah.
maternal health issues and obstetric fistulas and maternal and AIDS and everything you guys are talking about. One of the things that really concerns me, and you guys mentioned this, is getting men involved and reaching people who aren't tapped into this work necessarily. So I'm very interested in it, but I still kind of have to dig to find things about maternal health and about health in the developing world. Men or just people who aren't tapped in, aren't looking for it, how do we get them to access it? And you talked about this a little bit, but if you could just push it a little harder. So Women Deliver, lots and lots of supporters, and you said journalists, but people who can't access those film screenings at Women Deliver, how do we get that to them?
Okay.
Super. You can do it online. Almost everything we do is totally online. And we need to do a better job in this country. What happens in this country, honest to Pete, has a disproportionate influence on what happens in the rest of the world. But do you know that in this very city, probably a 35-minute subway ride from my desk on Broadway and Houston Street, there is a maternal mortality rate that is twice the national average in the United States. And the United States has dropped from, okay, it wasn't great to start with, the 41st in the world from best to worst. We were 41, not so cool. We're now 52. So it's not a problem that's over there. It's a problem that's here too. And we need to do a better job about personalizing this.
Okay, so the problem is also at home. So there is a lot you can do just by, in this city. One more question. Please go ahead, and then we will close with think about, one message you want to give to the audience. Yes, please.
Thank you so much for the panelists. I work for an NGO, Make Mothers Matter International, and we've been dealing with issues about mothers since 1947. And my experience for the last 8 years has been that we women were wonderful, we talk a lot about it, we know exactly what needs to be done. But at this juncture, I personally think that the only way, and I see that there are a few men, but as long as the men, we don't have NGOs called Make Fathers Matter or Make Men Fight Against Violence or things like that, we are not going to change the world, because in a way we're perpetuating, by being so wonderful us, it just is an indication that it's a woman's issues. It's almost, as if it behooves us to do everything, while at the end of the day, we need men. To me, it's the only solution. Men journalists have to tackle this issue. I don't know if you want to comment on this.
Yeah, okay, great. So this is a very good message. Men needs to be involved, and we need perhaps a documentary about how men are involved and get this message out to other people to try to get men into this movement. Here is the man. Here's the man, and this is fantastic. Do you have anything coming from the Twitter thing? Any question? No. Okay, so one more message. No, we are not going to do any more questions. We need one message from the panelists, fantastic panelists that we had this morning. So starting by Lisa.
For all the filmmakers who are out there, I think there is absolutely opportunities for you to use your craft to tell these stories. You gotta embed yourself in the international community somehow, because if you don't know the UN lingo, I think if you don't know who's who, you lose a little bit of credibility. So go to the Social Good Summit. I think I heard somebody announce it. It's in September alongside the UNGA. I'm curating, as everyone said, a 3-day cinema corner at Women Deliver. We're going to be releasing the links where you can watch a lot of the films online. Follow it. Hashtag is Cinema Corner. We've programmed all sorts of films from all different types of filmmakers, which is exciting. And what else? 3, I'm going to be releasing some films also if you're interested. My Twitter is Lisa Russell Film, and I'd love to hear what you all are working on as well.
Great. Lisa, Jill, 1 second, 1 minute, actually.
Okay, 40% of the people who come to Women Deliver are men. There's a start. The second idea is we've got to invest in young people, young guys and young girls. And I'm talking about secondary school and universities, because that's where the world is headed. Half of us are under 25 in the world now. And it's a group that makes some people really uncomfortable, but that's where we got to go.
And the final thing, I want to encourage all of you who are in creative media to, we're not talking about, you don't have to do something about maternal health or fistula or pediatric AIDS. It's I think, actually even more effective to show the behaviors. It doesn't have to be a documentary. It could be mainstream TV. Don't forget social media. You know, clips that include humor, that include a great story, that show a man, we're talking about men, that show men being supportive and involved without hammering somebody saying, men have to be supportive and involved. That's not going to change anybody. But what does change people and young people is seeing it over and over, integrated into their favorite stories and television shows and movies.
Okay,
so that's what I'd
great.
like to
With
leave.
this, with this fantastic message, we're going to close, and we'd like to hand for all the panelists. Basically, thank you so much, Jill, Lisa, and Robin. Basically, I want to say we need to expand the messages. We need to expand the work with messages so that we are not just the converted that support the work towards achieving the maternal mortality, decreasing maternal mortality goal. We need to reach to many, many more people, in particular those who have the capacity to make a difference and make decisions. So thank you so much.